What happens when the U.S. government decides to ban soda and junk food from a program that feeds over 41 million low-income Americans? It's not just a policy debate. It's a geopolitical battle over health, economics, and control. On April 11, 2025, reports emerged that President Donald Trump and his administration are pushing to prohibit SNAP recipients, those using what's commonly known as food stamps, from buying soda, energy drinks, and junk food, focusing instead on wholesome options like meat and vegetables. Nebraska and West Virginia have already signaled their support, with governors in both states seeking permission to implement these bans. This push, driven by Trump and Health Secretary Robert F. Kennedy Jr., falls under their Make America Healthy Again agenda, led by the Departments of Health and Agriculture. But the debate over what SNAP users should be allowed to buy has raged for years, and it's raising bigger questions about power, equity, and global influence. Let's break this down in 6 steps, exploring the stakes, the players, and the broader implications of this policy shift. No fluff, just real insights to help you navigate this complex moment. Let's dive in. Chapter 1. Trump's New SNAP Vision. On April 11, 2025, reports surfaced that the Trump administration is targeting the Supplemental Nutrition Assistance Program, SNAP, with a bold new policy, banning the purchase of soda, energy drinks, and junk food. Trump's team wants SNAP to focus on wholesome foods like meat and vegetables, arguing that taxpayer dollars shouldn't fund unhealthy choices. The administration is urging every governor to request waivers from the U.S. Department of Agriculture, USDA, to implement these restrictions in their states. Nebraska and West Virginia are early adopters, with their governors announcing plans to seek federal approval for the bans. This move is part of the Make America Healthy Again, MAHA agenda, championed by Trump and Health Secretary Robert F. Kennedy Jr., with support from Agriculture Secretary Brooke Rollins. Kennedy has been vocal about the issue, stating on Fox News in February 2025, "We shouldn't be subsidizing people to eat poison." Rollins echoed this sentiment, telling reporters, "When a taxpayer is putting money into SNAP, are they okay with us using their tax dollars to feed really bad food?" The policy aims to redirect SNAP's focus toward nutrition, but it's sparking a heated debate about government overreach and the realities of food access for low-income families. Chapter 2. SNAP and its global reach. SNAP, often called food stamps, is a cornerstone of the U.S. social safety net, serving over 41 million low-income Americans in 2024, according to the USDA. The program provides monthly benefits, averaging $192 per household member, to help families afford groceries. But it's long allowed purchases of items like soda, candy, and processed snacks, alongside staples like meat and vegetables. Exclusions currently include alcohol, tobacco, and hot foods, prepared for immediate consumption, as defined by the Food and Nutrition Act of 2008. While SNAP is a domestic program, its implications ripple globally. The U.S. is a leader in food policy, and changes to programs like SNAP can influence international standards on nutrition, welfare, and public health. The $113 billion program intersects with global trade. Subsidizing junk food purchases supports multinational corporations like PepsiCo and Coca-Cola, whose products dominate SNAP spending. A 2016 USDA report found that soft drinks were the top item purchased with SNAP benefits, accounting for 5% of spending, outpacing fruits and vegetables. Banning these items could disrupt corporate profits and trade dynamics, a subtle but significant geopolitical shift. Chapter 3. The Make America Healthy Again. Agenda. The push to ban junk food from SNAP is a flagship initiative of the Make America Healthy Again agenda, led by Trump, Kennedy, and Rollins. Kennedy, a longtime critic of processed foods, has argued that SNAP's allowance of sugary drinks and snacks fuels chronic diseases like obesity and diabetes. In a March 2025 interview, he called soda a taxpayer-funded subsidy for lower-income kids, a view shared by Rollins, who has emphasized aligning SNAP with nutritional goals. The MAHA agenda aims to tackle America's health crisis. 75% of adults and 33% of children are overweight or obese, per CDC data cited by Rep. Josh Brecheen, an Oklahoma Republican who introduced the Healthy SNAP Act in January 2025 to exclude soda, candy, ice cream, and desserts from SNAP purchases. Nebraska and West Virginia are early adopters. West Virginia Governor Patrick Morrisey announced on March 29, 2025, his intent to request a USDA waiver to ban soda purchases, a move Kennedy celebrated, urging other governors to follow suit. Nebraska's governor has also signaled support, aligning with the MAHA movement. Other states, including Arkansas, Utah, and Idaho, where a bill banning candy and soda passed both chambers by April 3rd, have joined the push, reflecting a growing Republican-led effort to reshape SNAP. But the policy faces hurdles. The USDA has historically rejected such waivers, citing logistical challenges and lack of evidence that bans improve health outcomes, as noted in a 2007 agency paper. Chapter 4. The Debate Over SNAP Restrictions. The debate over what SNAP should allow isn't new. It's been raging for decades. The Food and Nutrition Act of 2008 defines SNAP-eligible items broadly as any food or food product intended for human consumption, excluding alcohol, tobacco, and hot foods. Banning specific foods requires either congressional action or state waivers, both of which have failed in the past. In 2011, the Obama administration blocked New York Mayor Michael Bloomberg's bid to ban soda from SNAP, citing implementation difficulties. During Trump's first term, the USDA rejected Maine's 2018 request to block candy and sugary drinks, arguing it would increase administrative costs and not necessarily improve health outcomes. Critics of the ban argue it's paternalistic and ignores systemic issues. Public health experts like Valerie Imbrus from Washington College have pointed out that soda and candy are cheaper and more calorie-dense than healthy options like fruits and vegetables, thanks to federal subsidies for the U.S. sugar industry. In food deserts, areas with limited access to grocery stores, processed foods are often the only affordable, shelf-stable options. A 2016 USDA report found that SNAP households spend similarly to non-SNAP households, with soft drinks accounting for 5% of SNAP budgets compared to 4% for non-SNAP households, suggesting broader dietary patterns across income levels. Critics also warn that restrictions could stigmatize recipients, as noted by Empower Missouri's Christine Woody, who advocates for incentives like the Double Up Food Bucks program to encourage healthy purchases instead. Chapter 5. Geopolitical Implications of Food Policy. At first glance, banning soda from SNAP seems like a domestic issue, but it has geopolitical undertones. The U.S. sets global standards in food policy. Its agricultural subsidies, trade agreements, and welfare programs influence international markets. SNAP's $113 billion budget indirectly supports global food corporations, with soda giants like PepsiCo and Coca-Cola benefiting from billions in annual SNAP spending on sugary drinks. A ban could disrupt these corporate profits, potentially affecting U.S. trade relations, especially with countries that rely on American food exports. For example, Mexico, a major soda consumer, might face pressure to adopt similar health policies if the U.S. leads the way, reshaping global consumption patterns. The policy also intersects with global health trends. The World Health Organization has long advocated for reducing sugar intake to combat obesity and chronic diseases, but U.S. food policy often prioritizes corporate interests over public health. By targeting SNAP, Trump and Kennedy are challenging this status quo, potentially setting a precedent for other nations to follow. However, the move risks alienating allies who depend on U.S. food exports. Processed foods are a significant part of American trade. Additionally, restricting SNAP could exacerbate food insecurity in the U.S., impacting domestic stability and, by extension, America's global influence as a leader in social welfare policy. Chapter 6. A Geopolitical Reckoning on Health and Equity. Trump's push to ban junk food from SNAP is more than a health policy. It's a geopolitical reckoning on the intersection of health, equity, and power. By targeting soda and processed foods, the administration aims to reshape dietary habits and reduce chronic diseases, but it risks deepening inequities for SNAP's 41 million users, who often lack access to affordable, healthy options. Geopolitically, this move challenges the global food industry's influence, potentially shifting trade dynamics and setting new standards for public health policy worldwide. Yet, without addressing systemic issues like food deserts and agricultural subsidies, the ban may do more harm than good, highlighting the tension between domestic priorities and global impact. As states like Nebraska and West Virginia lead the charge, this debate will test whether health can trump economic and political interests, or if the cost of change will prove too high for a world built on consumption.